And we are live. Wonderful. Yep, everything looks good. Well, welcome and thank you for joining us for our special presentation entitled Spotlight on Lupus and Stress, an educational symposium sponsored by GSK in support of National Stress Awareness Month. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you're unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect and to grow and hopefully inspire each other throughout the peaks, which are the highs, and the valleys, which are the lows, of our unique lupus journeys. And I say "are" because I have lived with systemic lupus and multiple lupus overlap conditions since the age of 11. Now, we believe that every person living with lupus, no matter their background, should be treated with equity and dignity and taken seriously. And it's our mission that patients feel heard and seen and valued. And today's event will spotlight the unique challenges and triggers people living with lupus face, and how important it is to acknowledge the stress that comes from living a life with a chronic illness. And by the way, please make sure that you share. You're going to hear me say this a few times. Make sure you share this live event on your Facebook page so that people can get connected to community and a community of support and have access to some incredible information and resources that will be shared today. In fact, every person that shares this event on their page will be entered to win a Mindfulness Desk book. It's a little book we have here. There it is, yes, with over 100 tips and tricks, I believe, designed to lower stress and increase mindfulness, written by our special guest today, licensed therapist Teresa Jansen. So before we continue and I introduce our guests, please allow me to give a brief disclaimer. So please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and/or opinions of your doctors. If you are experiencing lupus or lupus overlap symptoms or mental health issues, it is important to follow up with your doctor or your health professional and to seek the treatment that is best for you. Our panelists are qualified professionals. However, they are not liable for their comments since they are not acting as your personal physicians, medical advisors, or health providers. So it's time that we, as a patient community, delve deeper into this conversation, and I am thrilled to have Tatiana with us, Patient Engagement Liaison and Advocacy Representative for GSK, here to get us started. So since time is of the essence, I'm going to hand it over to you, Tatiana. Thank you for being here.
And thank you so much for having me and for this collaboration that we've started between More Than Lupus and GSK, the advocacy department. I'm a patient engagement liaison and I work for GSK, and my role is to come out into the communities and to educate people about lupus and participate in events like this one. I am a registered nurse. I've been a nurse for 10 years, and I did take care of patients that had lupus during my nursing career, and especially I was more impacted by those that ended up in critical care, which is where I practice most of the time. And what really surprised me and made me sad was that they didn't really know much about the disease, and that's what they ended up in the hospital. So events like this are so important because the more awareness we bring up for lupus, and more people can get diagnosed earlier. And also for those that are already diagnosed, then they can be more proactive and prevent those complications. And before I get started, I want to remind you all that my presentation does not take the place of talking with your doctor. And having a chronic condition can be very hard. Having lupus can be even harder because a lot of the symptoms and signs of lupus are invisible. So they're in the inside of the body, including the brain and the nervous system, which is why lupus sometimes can show up as depression, brain fog, and all the other issues that can come up with lupus attacking the brain and the nervous system. And one of the things that a lot of people that have lupus get is like, oh, like, but you look great, which may be meant as a compliment, but it only makes the person that has lupus feel even more lonelier, because now they have to prove how they don't feel great, and then they have to share why they don't feel great. The other thing that also affects people is when they go into their doctor's appointments, they not only have to show up prepared, but they also have to advocate for themselves and prove that what they're feeling needs to be followed up and checked on. And all of these things are just examples of how lupus can be very isolating. And all of this can have a negative impact on your mental health. Oh, I am so sorry. I'm not sure why that is happening. Okay, so, and today I want to talk about the lifestyle of lupus. People with lupus have to be very careful and proactive when it comes to their management of lupus to prevent flares. And we care about flares when we're talking about lupus because they can be very dangerous, and they can lead to complications and even can end up in hospitalizations. So I want to talk about what you can do at home and every day, and ways in which you can be more proactive in the management of lupus. And these are just lifestyle topics that may help you feel more in control and hopefully may lead to you feeling better overall. So let's start with nutrition. Your body is made up of several systems that work together to help you keep moving, right? And what you eat and drink affects your bodily functions. So it's not a surprise that food has an effect on our body, and sometimes it can be positive and it can be negative. So maintaining healthy nutrition, it's very, very important when you have lupus. And maintaining a healthy nutrition doesn't have to be something that's so complicated and hard and many ingredients and steps. You have to be very creative and just stick to a pattern of healthy choices that is simple and something that you can practice long term, and it becomes part of your life. And studies have shown that eating a healthy diet can help with nutrition related chronic illnesses like obesity, heart disease, high blood pressure, osteoporosis, and others. And when we're talking about diet and lupus, not one diet is correct for everybody that has lupus. So you really need to talk to your doctor and see what they recommend and what changes you can make to your diet. Maybe you can ask what foods you should add to your diet, or maybe be mindful of. And you can also ask your doctor about a referral to a nutritionist if you feel like you need the help. And it's just a good idea to talk to someone that's an expert in nutrition. And in the meantime, I have some tips for all of you, starting with understanding your caloric needs. So how many calories do you need a day? The USDA provides a guideline, and they go by a general perfect body, perfect person, and that's about 2,000 calorie diet per day. But that may not be the right thing for you or for everybody. So really understanding your needs and that it may be different. You may need more food or less food, and how you feel and listening to your body is key. Also, striving for a plate that is balanced. So you want fruits, vegetables, grains, protein, oils, fat-free or low dairy or low-fat dairy. And also being mindful of processed foods because they can be high in sugar and sodium. And understanding that, processed foods can also mean anything that has been changed in any way and packaged. That includes frozen vegetables. So I didn't know that before I started doing this presentation, that frozen vegetables are considered processed, but they're not processed like when we're talking about a pasta sauce or maybe a salad dressing. So really understanding those labels and getting familiar with what you're eating and you're buying can help you make better choices. And of course, understanding what vitamins or supplements your body may need. And I do advise everybody to check with your doctor before you make any changes, and especially if you are going to be adding any vitamins, supplements, or minerals to your diet, because there is a lot of advice out there. And people have good intentions, and those are things that have been working for them, but it may not be the right thing for you. So really check in with your doctor, with your nutritionist before you try anything new. It's very important to prevent any flares or any issues. And being active, staying active does a couple of things. It helps to keep you healthy. It keeps your joints moving, and it's all about movement. You don't have to be exercising to really get the benefits of having your body moving. It's just about finding the right activity for you and the right activity level for you. And our bodies and our mind are connected, so there's no surprise that if you are staying active, it actually studies have shown that it leads to mental health, like better mental health, and it helps you feel better. It helps strengthen your confidence and your mood. So find something that helps you feel good and keep on moving. The CDC recommends 30 minutes of brisk activity 5 days a week, but that is just a general recommendation. You can start anywhere that you feel comfortable at, and always listening to your body, and discuss with your doctor what activity level they recommend and what activities they may be so they may want to have you do. And another thing that you can do and ask your doctor is maybe a referral to a physical therapist. If you're having a particular issue, a physical therapist can help you overcome and really correct that issue. And staying active, you have to be very careful when you have lupus, because being active can also put your body under stress, and then it can also make your symptoms worse. So really being mindful of what your goals are, and talking to your doctor about what those goals are and how can you achieve them can help you stay very safe. That way you are moving, but you're not really triggering your body into anything. And you can choose an activity that it's enjoyable to you. Not everybody likes the same. Not everybody has to be running and jumping and doing things. You can just meet a friend for coffee and a walk. You can go walk your dog, or maybe you want to try low impact exercises. So anything that keeps your body moving is what we're recommending, and anything that keeps your body safe and free of any stressors that you can cause by trying to stay active. So really being mindful when you're moving, being cognizant of maybe you're doing too much or pushing yourself too much. So that is why we recommend low impact exercises, because they keep your body moving without putting all that stress on your body. And then you still get the benefits, the mental health benefits from moving. Another thing to think about is sleep. So sleep can affect your metabolism, your weight, your immune function. It can help disease resistance and overall quality of life. And when we talk about sleep and lupus, we also know that lack of sleep can be a source of stress on the body. And it becomes this whole cycle where you don't sleep well, you have a flare, or your symptoms become worse. And then because your symptom and your body is hurting, then you don't get enough sleep. And then you just get stuck in that cycle of not getting enough rest. So it's very important to understand that your body needs rest, that you need to prioritize it, and also to, again, listen to your body. And they recommend 8 hours of sleep. That is 1/3 of your day. So you have 24 hours in a day, you're sleeping 8, leave 16 hours of the day to play, work, play, and then plan your night, right? So very important that you talk to your doctor if you're not getting enough sleep, because it can really make a difference when it comes to your lupus and also your mental health. So what can you do to get better sleep, right? There are a few tips here. So identifying how much sleep you need is key. Not everybody needs 8 hours of sleep a night. Some people do very well in 4 hours, 6 hours. Some people need 10. So really identifying what that magic number is for you is important. And also it may depend on your mood, your stress levels, your physical health, and talking to your doctor may help you come up with a number that's appropriate for you. And then that gives you a goal and like a starting goal for you to plan on how you're going to get more rest. Also, keeping a consistent schedule. So every day, go to bed at the same time and then try to wake up at the same time. And while you're getting and working on your sleep and getting into a rhythm, try to keep that even on the weekends, because then that helps you stay consistent. And we do that for children. We stop doing it as adults. So it only makes sense that we, go back to the basics when it comes to sleep. Creating a sleep friendly room. Uh, it's better if it's dark, if it's relaxing, and if the temperature is cold and electronics free. So don't turn your TV on if you have one in the room if you are going to bed, and trying to get that routine. So training your brain that at a certain time you're going to go to bed, that you need to slow down and start relaxing. It's very important. So you can listen to music, you can stretch, meditate, and then we also recommend naps. So if you are feeling tired throughout the day, you can take a nap. It's not going to affect you, but you have to learn how to take naps so that way it doesn't disrupt your sleep schedule. So keep your naps between 30 to 60 minutes. Nothing more than 60 minutes should really be considered a nap. And also do it hours before you go to bed. So don't take a nap 30 minutes to an hour before you have to go to bed, because then that disrupts your whole sleep cycle. And one thing that I do want to mention is that taking naps throughout the day when you have lupus is not you being lazy. It's you listening to your body, you slowing down and allowing your body to rest and recuperate from all the activities that you're doing. And when you're not feeling the best, they always say, oh, go outside, go in the nature, take a walk. And that seems very, very appropriate. We know that there are benefits from people going outside. But when you have lupus, it doesn't really work that way. Lupus can cause sensitivity to ultraviolet light, and those are the UV rays that we hear about. And it's called photosensitivity. And that photosensitivity can become a trigger for lupus symptoms. So a lot of the times what happens is somebody that has lupus goes outside trying to feel better, trying to be active, and they come back and they may have a rash and they may feel extremely tired, like fatigue and joint pain, from lupus attacking the body from the inside. And that can last from a couple days to even weeks. So being very, very mindful of how you are going out and when you're going out can really make a difference, because it's important that you're getting out, but how do we get out outside and still be careful, right? So UV rays are strongest between 10 a.m. and 4 p.m. So try to go out in the morning, get your walks and your activities either before 10 a.m. or 4 p.m. And make sure that you're wearing sunscreen. Anything that's SPF 30 and more, it's going to be effective. If it's less than that, it's been shown that it's not effective. It's not covering it's not blocking the UV rays as it should be. And you also need to reapply sunscreen. If you're not reapplying throughout the day, or if you get wet, like if you're going to the pool and you get wet and you come out, you need to reapply sunscreen to make sure that your body is being protected. And if you have darker skin, you still need sunscreen. If you are indoors, you still need sunscreen, because those UV rays are still coming in and you don't want your lupus to be triggered. And you can also block the UV rays by using clothing that's tightly woven or long sleeve or a floppy hat. And now they have UV resistant clothing that you can buy. So you can get very creative and still get outside. And taking care of your mind, it's so important. And one way to do this is by slowing down. And we live in this world where we have so much coming into our bodies, our mind, where it's always stimulating and exciting, and you have to pay attention to something that's happening and keeping you entertained, that may not allow you to really get in touch with your body, with your feelings. Or maybe you're not doing well emotionally, but because you're so busy and so entertained, you're not really noticing. So mindfulness is very, very important, is to be aware of your thoughts and your situation without judgment. It's to be present with acceptance and without judging your body, your situation. And it's been shown to be extremely helpful when it comes to mental health. So mindfulness-based stress reduction can help with mental and physical benefits. So what does mindfulness meditation look like? There is mindful breathing, body scan, and mindful walking. So mindful breathing is just focusing on your breathing. And a lot of people are really good at this, but if you have a brain like mine, my brain does not stop. I try to, when during COVID as a nurse in the ICU, I try to practice mindfulness, and my brain will not shut up. And especially if you're in an environment where you can't just be quiet and calm, and it just means that you're concentrating on your breathing, that you are giving a break to your brain, and you are allowing your body to slow down. So one thing that I do to practice mindful breathing is to do box breathing. So you breathe in through your nose to the count of 4, you hold it for 4, you exhale through your mouth and you count to 4, and then you hold it while you count to 4. So I used to do this all the time. I still do it. I do it before I do these presentations. It slows me down and it helps with the heart rate. Like breathing and your heart are connected. So if you slow down your breathing, it slows down your heart and then your body feels better. Body scanning is focusing through your body from head to toe. And one way that you can do this is by going on your bed or maybe sitting down and being very calm and quiet and just paying attention to your body. And a technique that I have for body scan, you can tense up and then relax and move on to the next section. So you can do your face where you just scrunch up your face and then you relax it. And then you can do your neck area and you know, tense it up and then relax. And you can do your arms and then you can do that throughout. And you may be able to find areas of tension where you're like, oh, that kind of hurts. And then as you're working and, you know, focusing on your body and your breathing, then some of that tension can leave your body. And the last one is mindful walking. It means that you're out walking with the awareness of what you're looking at, the sounds, the sensations, the smells that you are experiencing. And you can just focus on every time that you take a step, how that feels on your body. How does that shift, that weight shifting from one step to the next feels? And I want to finish with self-appreciation. This is the last part, but it's also one of the most important ones because lupus takes a lot from you, and then you have to do all these things to feel yourself and to overcome the way that lupus slows you down, right? And lupus and self-appreciation are part of the lupus lifestyle. And it's something that you can remind yourself of daily. And just be kind to your mind, to your body. And one way that you can show yourself self-appreciation is to being mindful of how you talk to yourself and how you treat yourself. Because you should treat yourself like you are your favorite person, because you only have one body and one person. So you should be showing yourself compassion, appreciation, and gratitude. So always be mindful when you want to, you know, maybe not be so kind to your body, stop yourself and then highlight things that your body can still do, or highlight things that you're proud of in your mind. And these are our resources. I recommend the one with the symptom tracking because it has a lot more than just the symptom tracking. It has most common used words by doctors. It has an impact tracker, and then it also takes you to our Us in Lupus page. So that is a community of lupus warriors. And then you can also go to gskplacehub.com and then come and see our webinars.
Thank you so much, Tatiana, for your informative presentation. We have a very active chat box going on here with a lot of people joining in and saying, you know, what their stressful things are of living with a chronic illness. We have comments all over the US coming in where some are saying that it's really stressful just going to a doctor's appointment. Some are saying that not being taken seriously by their doctors and by the people in their life is really stressful. Um, Not knowing what each day, each moment's going to bring.
Mm-hmm.
Living with a chronic illness is stressful. A lot of comments here when doctors just don't seem to be tracking with you and understanding how do you explain how you feel. There are a lot of big feelings here, and honestly, I can relate to all of them.
Mm-hmm.
People not understanding and following through with commitments because oh, people not understanding when I can't follow through with commitments because I never know how I will feel. Yes, yes, your illness may be unreliable, but you are not. I feel that. Yes, I want to acknowledge that. How to manage the stress, not being able to get treatment. We are really seeing a lot of vulnerability here with people posting. I'm trying to plan things to do and then realize I'm not able to do them. I have to cancel. Yeah, trying to make your yes be yes and your no be no. That's really hard when you are wanting to be somewhere and wanting to commit to something and you can't because all of a sudden you have a flare or maybe you're out in the sun too much. There was a question about being out in the sun, Tatiana, before I
Yeah,
let
I
you
think
go
I
here.
saw it. I think it was like how long uh, you can be outside before being affected. So
Yeah.
there are a couple of things with that. The time that you're outside. So are you outside between 10 a.m. and 4 p.m.? Probably not very long. Are you
Mhm.
wearing sunscreen? How long ago did you apply your sunscreen? And also, or is your skin protected? Do you have a hat? So if it's before 10 a.m. and after 4 p.m. and you have sunscreen and a hat, you're pretty safe. But so you have to be very strategic when you are going outside. Wear
Mhm.
your sunscreen, wear your hat, and then listen to your body. If you are realizing that you went to a park with friends and you were out there for 2 hours and you did everything that I recommended or that we're all recommending, which is covering your body. You went after 4 p.m. and then you are wearing sunscreen, but you still felt the effects. Then try to be mindful and tracking. Okay, so how long was I out there for? Maybe next time I can only stay for an hour. And then communicate with people. And one thing that I do want to share is that if you are communicating openly and then maybe sharing with people like, hey, right now I feel well and I want to make it to your event. But if the day off, if my lupus is flaring and if I can't physically make it, I have to cancel on the day off. Don't be mad. It's just that living with lupus means that I cannot push my body because it could cause a flare and I could end up in the hospital. So, really communicating clearly and setting boundaries would be very helpful. And also, showing up when you can and being present and not being on your phone can make a difference because then your friends, there's that connection, right?
Mhm.
And people want to understand you. People that are around you that care about you want to know and learn.
Yes. Yes. Well, thank you so much, Tatiana. That was very informative, and I appreciate all the information you shared during your presentation. And now we have the pleasure of introducing a very special guest, a presenter that's not only a supporter of More Than Lupus, but a dear friend of mine. Teresa Jansen is a licensed therapist, and Teresa is trained in lifespan integration, spiritual trauma, EMDR, and she is a Mending the Soul and spiritual trauma group facilitator. And she uses person centered, strength based approach along with many individualized interventions to help her clients reach their goals. She supports people working through addiction, anxiety, career goals, depression, PTSD, parenting trauma, relationship concerns, all of that. So I'm so happy to welcome Teresa. Teresa, let's see if we can get you on here. Everyone can hear her and see her okay.
All right. Can you hear me
Teresa?
and see me okay?
Yes, I'm going to just remove myself and work kind of behind the scenes here and let you have the floor.
Wonderful. Well, again, just thank you so much, Tatiana. I think every single time I get to participate in events like this, I learn a little bit more. I think it helps all of us expand both empathy and what other people may be going through, but also sort of being seen and heard in our own experiences. I'm hopeful that some of the people joining us today are having a little bit of that experience. I'm also seeing some really good comments here. I think Melissa said it's hard in general to manage stress. Yep, let's start with that today. It is hard in general to manage stress. Robin mentioned about getting into treatment. Edwina mentioned insurance. There are so many different stories that are coming in to join this presentation, so many different reasons why we might be here. So whatever reason brought you in, I just want to thank you for being here, for participating. Typically when we're learning new information or showing up to learn, we have two running dialogues going on. One is, this doesn't apply to me, or two is, I know this already. And so if any of that is coming up for you, I just want to invite you to shift into growth mindset with me a little bit. And if it doesn't apply to you, just being curious what might apply to me. And if you know this already, asking what might I learn? what might I not know yet? So I just appreciate you being here. And I'm excited to share a little bit more with you. Tatiana's coming from a medical health field, and I'm on the mental health side of that, although obviously they cross-relate in so many different ways. As Kelly mentioned, I work primarily with people dealing with lots of different types of presenting challenges, but primarily trauma. And so trauma might be defined as stress on steroids, basically when something expands beyond our internal and external ability to cope. That's what we define as trauma. So it's beyond what our internal and external ability to cope against a perceived threat. And so what I'm hoping to bring in today from a mental health perspective is how we can catch stress, how we can be formative, preventative about stress, as Tatiana has already spoken to a little bit, before it turns into something that could ultimately be much harder to deal with. And I know many of you are good at doing that already. Many of you have your own practices, but hopefully I'll bring in a few things today that maybe you haven't heard before, maybe you haven't heard in quite the same way. So I'll speak to a little bit and then I'll bring up my presentation or a couple of pictures that I have in just a minute also. Tatiana talked about box breath, square breath, mindfulness. Kelly, you said something that just stuck with me, so I want to start with that. You said your illness may be unreliable, but you are not. And I love that statement. That that mindset is what I'm going to be speaking about today, about how we can help decrease stress by increasing mindfulness, growth mindset, and observing identity. So how we can decrease stress by mindfulness, by growth mindset, and by observing how that stress is actually going into an internal dialogue that might be speaking to identity. So when Tatiana was sharing on her last slide, be kind to yourself. This is so important. I want to maybe add to that in a little bit on like how, yeah, easier said than done. But when we have those really rough days or we feel triggered, maybe beginning to get beyond our internal and external ability to cope, it's hard to be kind if we don't have lots of practice and maybe some models in how to do that. So I just appreciate everything that you've brought in so far. I'm going to start with this phrase. I use this in therapy a lot, which is when our body feels vulnerable, old stuff comes up. Really like the most basic bumper sticker for why people might move into a therapeutic relationship. When the body feels vulnerable, old stuff comes up. What that means for trauma therapy is if someone's in a car accident and they suddenly feel vulnerable, they might come in to get their PTSD treated for the first time ever because they suddenly remembered a time they did feel vulnerable. And that really scary experience actually became an opportunity for healing. So I would never wish stress on anyone. I certainly wouldn't wish any type of chronic condition, but I am thankful. I'm going to park a flag in finding ways to appreciate the opportunities it brings up for us. So as with all topics, I am not your healthcare provider. I am one. And so if there's anything I'm speaking to that doesn't quite resonate or you'd like to follow up, please do that in your own places. But I'm just excited to share some of my perspective. think Kelly used a phrase also, BL or AL, before lupus or after lupus. And I wanted to speak to that a little bit because that also speaks to identity. I imagine that everybody joining us today has some experience with BL and AL experiences. Anytime we go through a major stressor, a new diagnosis, a major change, identity stuff is going to come up. I was this way, but now I'm another way. I thought I could do X, Y, and Z, but now I can't, or now I'm doing it differently. And so we start getting curious what the internal dialogue is when that big change happens. And it might be something really basic, like I'm a good person or a bad person, or as Kelly said earlier, I may be a person who his illness is unreliable, but I'm not unreliable, and trying to tease that apart a little bit. I have just a couple other things. I have things that I am aware of will come up a lot, especially in the wake of a new diagnosis or major change. One is just appearance. We looked a certain way and now we don't, or we can't reliably look a certain way. Can make a big difference with who am I if I can't show up this way that I'm used to. Another way it can impact so many of us is ability to work, and just knowing that maybe that you had a specific role or a role at work or a type of job that is now changed or shifted in some way. Maybe you were a major income earner in a family, or among multiple people, and now that's shifted, or now you're needing to depend on other people. Maybe there's financial difficulty. There's so many things here that could speak to what might rise our heart rate a little bit, what might contribute to stress. And I'm going to bring in a metaphor. I learned somewhere years ago that adult learners, which is probably most of us here, if not all, we learn through metaphor. We learn through story, about hearing stories and telling our own stories. And we learn through metaphor. And so I heard this metaphor years ago about a kayak in the middle of a river. And I'm from the Pacific Northwest. There's a lot of that picking up now as April is finally turning a corner. We start seeing a little sun out. I'm checking just because I'm trying to share my screen, but I'm realizing this is a new platform for me. So I'm just seeing if there's something special that I need to do that. If I click a button that says share screen, I'm sort of asking Kelly, who's hiding in the ether somewhere, then does it share the whole screen, or it will give me the option to share a little bit? Do you know? I'm going to wait and see. Maybe she's not tracking it.
You can share your screen, and then you can share a window. So if you press
perfect. Okay.
Send, then share screen, and then you can have a window. You can choose a window you want to share.
Okay, I think I chose a window. Can somebody see this window now? Perfect.
Tell me now. Okay. Yeah, I see it.
I work in mental health, not in technology, so thank you for your patience with me. But I just figured I'd pull up a picture of a kayak. If you think of a kayak in the middle of a river, you think about what a wonderful, lazy river sunny day might look like or feel like in a kayak. It is pretty easy to navigate if you'd like to turn around. So if you decide you'd like to go back to the shore, you paddle a little bit and go back to the shore. If you've ever been kayaking or seen somebody do this, as the river picks up, as you get towards a waterfall, it's much, much harder. It's much harder to turn those symptoms around. Well, and I'm translating this into a metaphor for symptoms. When we have stressors come up, it's much easier to turn them around when we're still regulated, when we're in something that we call window of tolerance. It's much harder to do once we're dysregulated, once we're feeling so distressed. That the part of our brain that would normally make really wonderful decisions actually shuts down. It's not that we're not trying to make different decisions. We just don't have that part of our brain accessible anymore. So my encouragement today as we move into this topic is to look for opportunities to be preventative and formative as much as you can. And Tatiana talked about that already, just finding habits, finding routines. I am sharing a little bit about window of tolerance just because maybe you've seen this before, maybe it's new. This is a zone that is optimal, that is part of our parasympathetic nervous system for rest and digest. And basically, anytime we don't feel like we're in some type of threat, if you think of sitting in a beautiful park on a beautiful day, you're in your optimal zone. You're in a I can handle it sort of a zone. When we get distressed and beyond stressed, we might be hyper or hypo aroused. either of these moments, especially ahead of time if we can get ahead of stress, but even in those moments when you're feeling really dysregulated, those are wonderful moments to have in your pocket some mindfulness and some plans. I'm noticing some of the comments. Just thank you for engaging. One of the other things that those moments lead to is identity statements. And so I'm going to bring in some really common ones. So maybe you'll recognize these, maybe they're brand new. This is a list of cognitions or distortions that I'll often share with clients. And the ones on the left are negative statements. I'm bad, I'm the worst, I'm stupid, whatever those things are. They are so common that they made it onto a printout. So I just want you to know, if this is you, if you have some of these or all of these, or this has been a part of your history, you're not alone. They're so common that we have a poster now to share them with people. But I don't want you to miss that the other side is also common, meaning that's something that we can build, we can learn, we can increase and repeat positive identity statements as long as they feel true enough. Then our brain actually begins to heal and speak different messages into our body the more we practice these types of positive statements. And that's, we call that neuroplasticity, or when our brain is flexible enough to grow and learn new things. When we're in a parasympathetic state, our brain can learn new things. When we're stressed or we're feeling in a triggered state, we actually can't learn. Our brain isn't in a very good space to do that. So positive statements: I'm a good person, I'm lovable, I belong, I'm safer now, I have choices, I can make it right, I can learn. Any of these that feel just a little bit true are really good things to have up somewhere. Take a picture of it, have it on your phone, have it handy, so that you accidentally see these positive statements throughout the day. I have a little asterisk, though, is that they don't work if you don't believe them. And so how do we do that? You find one that you just believe a little bit. I had one client look at this list and she says, I can't resonate with any of those statements, but I guess I can resonate with the one that says I'm human. I'm okay with that one. I said, great, that's your statement. And so she put that up. She began to repeat to herself as often as she could. And then to practice that feeling in or around the body, right? If I'm human, then what does that mean? Other people are human. So we start having a little more compassion. And that one of the ways that I'm inviting us to explore is self-care through mindfulness. Sometimes self-care itself can now be a triggering word. We heard it often enough through the pandemic that people were pretty overloaded. Is like that image of a kayak when we're all on the edge of the waterfall or falling off it, and there's a healthcare provider yelling off the edge, practice more self-care. Like, it doesn't feel very encouraging at some point, because we do need to see some systemic changes, some changes among compassion with healthcare providers, some financial, we need some support to be able to do self-care. So if you're in that position and self-care is like a bad word for you, then please just catch on to the word mindfulness with me, and we'll kind of move into why this version of self-care and living with lupus might be a little bit unique. I'll read this definition, although you can see it. Self-care, as we're defining it here today, is the routine, compassionate practice of taking an active role in cultivating and protecting one's own health, well-being, and happiness. Formatively, that means ahead of time, through or after periods of stress. So that's before, middle, and after, with a commitment to not let more pain accumulate. And I think that last statement, I really cared. That one resonated with me because we can only do self-care so much if we're not going into those same triggering situations again, to decrease those as much as we can. I love this statement here. Self-care is not selfish. The chat on the side here, practicing positive statements with a Wonder Woman pose. I love that. Thank you, Melissa. That we need to not just believe the statements we're saying, but to embody them. And so that is part of self-care, is finding new ways to embody the type of human and the type of person you get to be. I am a big fan of micro self-care. That's why I we'll get to it in a little bit, but these are from some of this desktop resource about micro mindful self-care. And there's lots of really good reasons to do that. It fills your cup. It invests in you like a bank that you can withdraw from later. It balances a boat. Obviously, life is filled with challenges, highs and lows, but it helps us balance it on purpose. And it plants a seed, planting small daily habits right now, just like my client who told herself she was human. They add up over time. They really genuinely change our brain. They create new pathways to healing and more resilience. Resilience is the ability to become strong, healthy, and successful again after something bad happens, the ability for something to return in some ways to its original shape. It is both a quality and a practice. So if resilience is a triggering word for you, you're like, I'm tired of being resilient. Cockroaches are resilient. Just know that it's both a quality and a practice, and it's not meant to be something we do just alone, right? Any self-care, any resilience is amplified 10 times over if we have even one or two people that we can share our experience with, can feel seen and heard by. So some of these practices are in the book about ways we can practice self-care. One of them is just so silly. If you wondered if you were going to get a little bit woo-woo from a therapist from the Pacific Northwest, yes, you absolutely are. I'm going to invite the awkwardness so that I can be awkward for you, and you can decide if you're open to doing some of these as well. Physical touch does wonders for the mind and body. Obviously, many of us don't get as much as we need. There is a practice where you just literally give yourself a hug, and you do that for at least 30 seconds or more. Sometimes slow tapping is a nice thing to do while you're saying one of those positive statements. So if you haven't already, I can't see you, so I won't know if you participate or not, but you're welcome to just begin tapping slowly with me and choose one of those statements on your screen. It might be, I'm safe. It might be, I'm awesome. It might be, I'm lovable. If you'd like to stick with the I'm human, might be, I'm capable. And we just continue breathing. See if you can get your breath a little deeper into your belly. We'll do this for about 10 more seconds. And exhale, let it go. That's it. We just regulated our nervous system in 20 seconds. You lowered your heart rate, you lowered your cortisol, you increased oxytocin, that love hormone that helps you feel a little bit loved. And it's wonderful to have time to connect or touch with others, with massage, with hugs. But if you can just do this for yourself, it actually begins to change things. So that's one of the things that sometimes we'll practice in therapy. Another one that I brought in today is Victory Shelf. And I've got maybe 2 or 3 more minutes. I'm checking the time. In that you remember a time that you had a win or an aha moment or something that you just feel really proud of. And so in those moments when you're having a very hard day or you're having a symptom, to have handy, to have like a literal list or something on a shelf, like a rock that somebody gave you or a card that someone said thank you for something, that you have that so you can't miss seeing it is a nice thing to have as a micro self-care practice. And then this is the box breath, or I call it square breath, that Tatiana talked about. I like to do this one with my eyeballs. Like I will actually look at a wall if I'm inside and trace my eyeballs up the wall, sideways, down the wall, and across again, because I also have ADHD and it just kind of helps me to have multiple senses active at the same time. And so again, I can't see you, so you're welcome to participate or breathe on your own, but we'll practice this a couple of times. And this engages a different part of our system that can be really helpful for regulating. So we're going to breathe in for 4, hold for 4, and exhale for 4. And we'll do that for about 10 seconds or so. So if you're willing, be brave, take a nice deep breath. Here we go, in for 4. And hold. And exhale. We'll do it one more time as you breathe in for 4. And hold. And exhale. See if you can get that exhale even longer, and you can continue doing that on your own or at any time you please. This engages such an interesting part of our very old part of our brain that is designed to remind us that we're not dead. Isn't that kind of a funny one? When we hold our breath as we go under the water for a bath or as we dive into a swimming pool, it's like holding your breath to remind your body that you are holding it on purpose. And when you come back up, there's a new kind of system that engages that says, I'm alive. And so it does this kind of nice regulating thing for the body. These are some of my favorite stretches. They're a little bit small, so I'm not sure if you can see them, but I just love what Tatiana was mentioning about small movements, right? We don't have to be perfectionist about scheduling a 30-minute jog or something. I do this cat-cow thing almost every morning now. I'm just getting older, so my back likes it. But you stand like you're kind of crawling like a baby. You arch your back like you're hissing like a cat, and then you round the back down so that you're kind of looking up. And then if you want to add to it, you bring the right hand up and the left leg, and then you switch. You bring the left leg up and the right hand. And this just helps kind of balance where the back is at, and it helps stretch out my body in a way that all the muscles that happen when we're sitting on screens a lot. Any of the other stretches, keep some of those handy. Have a picture of those nearby. Again, one of the best ways to create new habits is making it really, really easy. It's harder to tell ourselves to do them. It's easier to like have a plate in the fridge with the food we want to eat handy, so it's not hiding in the cupboard. You know, those types of things that we have up and ready to go, we're more likely to do. I'll wrap up on these last couple ones here. Lift and lighten is one that I like because it takes 5 seconds. If you want to join me, we go ahead and imagine that we have a string pulling you from the top of your head. Slowly, slowly, gently lift, noticing the length of your spine. Take a moment to notice your jaw softening a little bit, kind of like you have a big strawberry in your mouth. If you need a yawn, if you need a stretch, go ahead and do that and take a breath. And exhale, and that's it. Lift and lighten. Very user-friendly. I will land on this one today, which is Laughing Dragon. This one just literally makes me laugh. I have this exercise written down as 2 parts. One of them is fire breath, which is a yogi exercise where you breathe in very deeply and breathe out. This is an energizing practice. So some parts of mindfulness bring up the energy, other parts bring it down. This is an energizing one. So we breathe in, breathe out until we start noticing our core getting engaged a little bit. And then once you're awake and you kind of feel like maybe that's possible to be weird and do that, then you do this laughing dragon exercise, which is you just laugh 10 times in a row progressively. And so I'm not going to do the whole thing, but you go 1, ha, and then you do 2, ha, ha, and then you do 3, ha, ha, ha. And so your brain is doing a lot to keep active in that exercise until you get all the way to 10. You're trying to not miss it. You can't, count too long or too little. So you get all the way to 10, and I have yet to do this exercise and not actually end up laughing by the time I'm done. It's an old theater exercise. It just sort of makes you laugh. And so just noticing there are many things you can do to take good care of you. I'm so thankful for those of you that have chosen to join us today. I'm hoping we have a little bit of time if there's any questions. Oh, and the last thing I did want to mention briefly is mindful distraction. Most of the time we say mindfulness is a way to practice focusing on the body. With chronic illness or pain, we actually don't always want to do that. Shocking, we like to avoid pain. And I'm going to actually give sort of a weird statement of almost permission, although you do check all of this with your own healthcare providers. Sometimes checking in on the body is just too much, but be mindful of what's around you. And so I can say, I'm going to focus on red things today. And you just go on a walk and you look at those things. Or I'm going to focus on how many birds I can hear. Doing something to be distracted is okay short term, as long as long term, if your body's sending you messages that maybe need some attention, you come back to those messages when you feel like you're able. I just want to give you permission to be distracted, but be distracted on purpose. Don't just go to the phone scrolling. Take a few moments to choose something. And I appreciate you being here. Saying laugh therapy is great.
Okay, well, everyone is just really drinking this all in and enjoying your suggestions. And there were so many helpful tips, Teresa. Thank you so much for sharing. And I just have to say that last thing you said is so powerful, because we're told to always listen to our bodies, be mindful of our bodies, check in with our bodies. And just having that permission to be like, this is a lot all the time. And sometimes we need to just not focus on being in tune with our overactive nervous system and our overactive immune system and our sensory that's just on overload all the time from everything that's impacted by a systemic disease, and focus on the beautiful purple flowers that I'm going to see wherever or like the yellow flowers with the daffodils that are blooming here now everywhere. To me, that's something that I do. Like when I drive, I look for the yellow flowers. I look for the daffodils. And that is just one thing that in my day, I don't have to think about my pain when I'm having a really bad pain day. And we have permission to do that.
Absolutely.
That was really powerful. One thing that's kind of coming up here, and something that we've talked a lot about before in our spaces here at More Than Lupus, is that there is an anticipatory stress that can happen when we have no choice but to enter into spaces and places that may trigger thoughts and feelings of stress when we are going to a doctor's appointment or another appointment or a place or even having our blood pressure. Uh, you mentioned some calming techniques, but I'm just curious kind of what would be before the panic sets in, before the heart rate goes up, before the cortisol levels start to go up, 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 and we go into fight or flight mode. For those of us who have to enter those spaces quite frequently, and sometimes it could be triggered by a smell of a hospital or having your blood drawn or seeing a doctor that maybe you had a bad experience with before, what is that kind of go-to thing that you would say? Take a moment, calm down that nervous system. I know I'm putting you on the spot here.
Yeah, no, I would love to speak to that. There's two that come to mind for me, and the
Okay.
time we have, we'll make them quick. And one is just having a tangible or carryable object with you that also has one of those positive associations to it. I'm human, I'm enough, I'm okay, I can advocate, or whatever you need to hear. Maybe you have a caring person coming with you. Maybe you wish you had someone whispering in your corner, I'm with you, I'm holding your hand, this would be a little easier. Say the things you want to hear. As Brene Brown says, speak to yourself as if you're somebody you love. And so I like having a tangible object with me that I can physically squeeze when possible, right? Not every procedure allows that, but when you can, just having something physical nearby or that you can see nearby that can help ground. And it actually engages the attachment network. It makes us feel like we're squeezing somebody's hand. And so that's one that's kind of accessible. I just appreciate it. Another one is the slow tap with a positive association. And so if you're not super escalated, you can do this by picking an imaginary place. My favorite go-to happy place is my dog at the dog park in the sunshine, rolling on a worm. She just really gets in there and her little white belly and all her fur comes up. And I can't look at that image ever and not just beam. It just cracks me up. I'm like, you are like the cutest. And so I'll bring to mind that image and I'll do a slow tap for about 30 seconds or so before I transition. So before I get out of a car, before I walk through a doorway. And it might be nice to bring in a positive association also. I'm human, I have choices. When this is over, I'm gonna go get ice cream, whatever the thing is. But that slow tap is helping get the body into a more regulated state. So those are two that come to mind briefly. The third one is obviously if you do have a healthcare provider, check in with them. There's lots of other interventions with EMDR and lots of other types of things that we do, kind of like exposure therapy to help decrease some of those triggers.
Mm-hmm. Yeah, that's what a great tip. I think a lot of people are writing all this information down. And a lot of people have asked, will they have access to this information? And with Teresa's permission, I would love to be able to offer the PDFs if that's okay with you.
Anything that's been shared, you're welcome to share.
Wonderful. So those of you that said you want that, I will private message you and I can either email those to you or send them via Facebook or whatever you prefer. The I am statements, also the I am control, I'm not in control. The first, I think, picture you took and shared with us, I think that's really powerful. So thank you so much, Teresa. People are asking when you're going to come back. So I thank you. You guys are really
what an honor to be here as often as it feels helpful for this community. And thank you for setting up this symposium.
well, let's end on a fun giveaway. We talked about stress, and we hope that you didn't stress out hearing about stress. So we want to end with something fun and light. We have 6 people that confirmed that they shared this. So I'm going to go ahead and spin the wheel if you can see it there and see who we end up on here. Carrie! Oh, I'm so happy. Carrie, you were the first one to log in. You were the first one to share it on your Facebook page, and you won. Yes. So do me a favor, Carrie, and go ahead and private message us your address, and we will get that shipped out to you. And thank you again to Teresa for not only writing this and creating this mindfulness desk flip book. Is that kind of the what you call it, a flip book?
Those are all good words. I'll do 20 seconds. It's a resource I created in the pandemic because my professional colleagues were stressed out. And I was like, what do you do to do micro mindful things throughout your day so you have less stress? And they're like, I don't know. I drink at night. I'm like, okay, we got to slow down and have a conversation around this. And so it ended up being a 120-page resource with some of the tips from my colleagues, many of the tips I've done in my own research. So thank you for sharing.
It's so fantastic. I'm so happy for you, Carrie. And if you would like one and you didn't happen to win, or maybe you're watching this and you didn't have a chance to share this on your personal Facebook page, private message us and I can get you a link to where they're available. They're still available because there's tips, there's quotes, there's just check-in moments that are so easy and accessible. You're not going to drain any spoons by.
Oh, Carrie says it's a great birthday gift in April. Good timing.
Oh, fantastic. Wonderful. Yeah. So wonderful, wonderful resource for you. And once again, thank you so much to Teresa and to Tatiana from GSK, Teresa Jansen, and of course GSK for sponsoring this event. And as always, make sure you check in with yourself today. And if you are having concerns about your stress levels, please check in with the healthcare provider or consider counseling. And if you have any questions about that, feel free to private message us and we will direct you to places and resources to get connected to professionals. And as always, you can visit morethanlupus.com for resources and support. And we will be with you next time. Check back to all the ways to grace things that are happening here. And thank you once again to our special guest. And that's it. Have a great evening. And we will be with you again very soon. Bye-bye for now. Enjoy your evening.
Thank you, Kelly.